Hope you're starting your work week on a safe note. You're watching our special coverage of COVID-19. I'm Min San Hee. Korea is poised to see an expanded reopening of schools this week as officials of Seoul's Education Ministry move ahead with plans to start offline classes this coming Wednesday for even the younger scholars, including those in nursery and primary schools. Accordingly, in today's edition, we take a look at efforts to ensure a new normal within the academic arena and more. But first, as always, here are the headlines with our Kwon Soa and Noaram. Welcome.
Hi. Hello.
So let's start with the domestic updates. I understand we are starting the work week on a relatively better note than this past weekend.
Right, that because different from the weekend when we had cases, new daily cases in the 20s, now we are back to the teens. And according to the government's assessment over the past 2 weeks, the average number of daily cases was at 23.2 infections, meaning with 16 new cases today, the situation doesn't look too bad. We now have a little more than 11,200 cases in total and 267 deaths, a slight rise in people quarantined, and more than 10,220 full recoveries. And as I said, we have a drop in new daily cases this Monday. In fact, for the first time since last Thursday, cases dropped to the mid-teens. And going over to our map, we have 6 new cases in the capital Seoul and 6 in Gyeonggi-do province, 1 in Incheon, Gyeongsang-buk-do province, that is, and Daegu each. And 1 case was detected at the airport, while we have 3 cases that are imported.
So do we know what the sources are of the latest infections?
Well, a majority is related to the Itaewon case in the capital Seoul. As officials said on Monday, there are now 233 cases linked to the Itaewon club infection that spread to various people at different locations and of different age groups since the beginning of this month. Around 82,000 COVID-19 tests were conducted as of this Monday in relation to that case, along with massive contact tracing. Authorities note there are more people infected through chain transmissions than people who actually visited the clubs and bars the first spreader went to, and all multi-use facilities patients used are being revealed in government press releases. And another cluster infection in the capital Seoul at the Seoul Medical Center, though, appears to have been contained. Surgery rooms at the main building are to reopen today as no further infections besides the 4 nurses that tested positive last week were reported. However, as community spreads remain a concern, the government is mulling over enforcing face mask wearing rules when using public transportation. Bus and taxi drivers may refuse to take passengers who do not wear masks without having to worry about penalties. And it may also become mandatory to wear masks on trains.
Right. So meanwhile, overseas, Latin America is emerging as the new epicenter of the virus, I hear.
Yes, this as cases there have been surging in recent days, and especially with Brazil becoming the country with the second highest number of COVID-19 infections a few days ago. The World Health Organization called South America a new epicenter of COVID-19, with officials there saying Brazil is clearly the most affected country in that region at this point. The country has recorded more than 360,000 infections as of Sunday, with a death toll of around 22,000. What's different from previous epicenters is that developing countries, like many in Latin America, are showing a high rate of infections and fatalities among young people. In Brazil, patients under the age of 50 account for around 50% of 5% of deaths, that is, 10 times higher than in Italy or Spain. Meanwhile, with the skyrocketing figures in South America, the country with the highest number of COVID-19 cases, the U.S., has imposed travel restrictions on foreigners who have been to Brazil in the past 2 weeks. According to a White House statement, it's to ensure additional sources of infections are not brought into the U.S., and the measure is set to take effect on Thursday local time. Concerns, however, remain on domestic transmissions of the virus with the gradual reopening of beaches and parks where many Americans flocked to over the weekend, and authorities are calling on citizens to take individual responsibility when it comes to social distancing. And this as the U.S. has almost 100,000 fatalities, as we can see here, with more than 1.68 million cases, followed by Brazil and Russia with more than 360,000 and 340,000 cases respectively, and Germany surpassed 180,000 total infections. And down there in India is also becoming a serious spot. And in total, we have more than 5.49 million cases around the globe, with 345,000 deaths, and 2.3 million people have now fully recovered from the disease.
All right, so thank you for that. I'll come back to you after the regular afternoon briefing.
Thank you.
Right, Aram, let's start with an important meeting being held at the Blue House that was set for this afternoon.
That's right. President Moon Jae-in was to be chairing a finance meeting between the top officials from the ruling Democratic Party and the government, as well as Cheongwade. Now, they were to discuss ways to financially support and overcome the current COVID-19 crisis. Also on the agenda is a strategy to minimize the post-coronavirus era fallout and set out financial policy goals for the next 4 years. Now, the speed at which to implement these financial strategies was also to be discussed, as well as how much money is needed. The government is set to propose next year's budget to Parliament in September, as well as any plans arising from today's meeting.
Right, now let's turn to Korean nationals who were stranded overseas, but they're back home now. What's the latest there?
That's right. The Blue House says that as of last Friday, just over 30,000 Koreans have returned home from abroad since late January. Now, the number includes overseas residents as well as students and travellers alike. About 1,700 of them returned on chartered flights organised by the government. Just under 16,000 came back on temporary flights offered by local commercial airlines. And now hundreds of Korean nationals coming from 48 countries also used temporary flights arranged by foreign governments. And the presidential office said the government used all possible diplomatic routes to support the safe return of Koreans from around the world.
Right. And the government is using technology, or will be using technology, to better prevent cluster infections arising from clubs.
That's right, and this whole Itaewon case has been a concern, and that's why the government is taking action. Visitors to entertainment establishments like clubs and singing rooms will only be able to enter the sites only after digital verification. Now, this verification will be done via a QR code scanning system and is aimed at preventing false identification. Now, a test run of the system will take place early next month, with an aim to implement it in mid-June. Now, the QR code would include the customer's name, contact information, the store name, as well as the time of entry. So a lot of information there. With the customer's consent, though, the personal data would be encrypted and stored for 4 weeks before being deleted automatically. That's to alleviate any privacy concerns. Now, the government said it has decided to implement the QR scanning system to address the shortfalls of handwritten registers, which were prone to false entries or data breaches. Now, the measure is compulsory for entertainment facilities like clubs and bars and singing rooms, but other places can adopt it at their own discretion as well.
I see. All right, Aram, thank you for that. We'll see you again on tomorrow. It's time now for the regular afternoon briefing on COVID-19 here in this part of the world. Cases linked to the Itaewon outbreak, as our Kwon So-ah earlier mentioned, stand at 233 as of this Monday. Granted, the Itaewon outbreak has not led to an explosive number of infections, but cases tied to it continue to note a steady rise. Accordingly, health officials remain on high alert as, amid such circumstances, the country prepares for an extended school reopening this week for young scholars, including those in primary and nursery schools. High school seniors returned to school last week, though quite a number of schools in Incheon, that is, and Ansong, chose to cancel classes following reports of infections among high schoolers in the area. Now, authorities at the Korea Centers for Disease Control and Prevention believe the next 2 weeks will be a watershed moment for them. Here now is a briefing. We'll come back to you afterwards.
Let us now begin our regular briefing on COVID-19 response here in the country. As of May 25th, today we have 16 new more cases, and the total number of confirmed cases now stands at 11,206. We have 13 newly making new recovery, and a total of 10,226 have been discharged, and 713 people are in quarantine. Out of the 16 new cases, 3 were imported and 13 were local transmissions. And as for the imported cases, they were from one were from the Americas, and one from the UAE, and one from Kuwait. And as for the local transmissions is as follows. In Seoul's Gangseogu district, at one lecturer at an arts academy school has been confirmed positive, and a student who is in kindergarten has tested positive as well, and we are currently conducting epidemiological investigation as well. And as for the Yangcheongu Grace Methodist Church, we also have another church confirmed positive at the Gyeonggi-do province, and one person was tested positive there. And also this person was during a self-quarantine after after being at a meeting, related meeting of a religious meeting. And we have a total of 18 cases from that specific church, and we are also doing the contact tracing. And as for the 8 people who were at this meeting, one was from the Grace Church, and also 6 were from the Gyeonggi-do province as well. And in Elim Church in the Kuri city, we also conducted the investigations and screening testings for the people in that neighborhood, and we have confirmed 8 people who have tested positive, and they were including the families of one person of the students who tested positive at the Daegu Meister Hospital, and 7 were the service members at the church. And as of noon today, we have 237 cases in relation to the church, in relation to the Itaewon club case, and the 7 of them are fifth-hand infections, while 1 of them are confirmed to be a 6th-hand infection. And to this end, we are currently doing a wide and massive conducting of the screening testings for people who have been visiting the multi-use facilities, and they include about 30 facilities, including singing rooms and PC rooms as well. And we have disclosed a list of these facilities, and regardless of your symptoms, if you have been to these facilities, we ask you to get tested as soon as possible. And we are also seeing a surge in the irritations among the teenagers and the students in Europe and the US. And these inflammations are being witnessed as a new syndrome in these countries, and therefore, the South Korean government is also intensifying our inspection and monitoring against this syndrome. And in order to respond immediately against such syndrome, we are identifying the cases, and we are also having a widespread experts meeting. And starting from today, we will have a new guideline for reporting of such syndromes. And as for related symposiums and academies, we also ask the medical experts to report to the quarantine authorities as soon as possible if you report such syndromes amongst your patients. And starting from Wednesday, we will be opening the offline classes for many more students, including high school sophomores, seniors in middle school, first and second graders of elementary school. And we ask students and teachers to comply with the preventive measures, and students, teachers, and staff should stay home if they sick and if they have symptoms in the morning, and also they need to ventilate the school area, and they need to also always keep social distancing, and they need to also comply with personal hygiene measures, including washing of your hands and coughing etiquettes. And if their temperature is over 37.5 degrees, they need to let their teachers know, and they also need to wear the KF approved mask and wait in a separate location. And students students, teachers, and staff are urged to avoid karaoke rooms, PC cafes, nightclubs, and bars. And if a confirmed case is found in a school ground, all the students, teachers, and staff of the school will be instructed to put on a face mask, and the local municipal government will conduct a widespread epidemiological investigation and disinfection. And in light of recent rise of local transmissions related to clubs, bars, karaoke rooms, and after-school private academies, we ask the people to refrain from social gathering or visiting any enclosed and crowded spaces. If you have to visit these places, you have to follow personal hygiene measures, including keeping 2 meters of distance from other people, wearing face masks, avoid handshakes, and washing of the hands. And if you belong to the high-risk groups, including elderly seniors with above the age of 65, or pregnant women, persons with chronic illnesses, should especially avoid any poorly ventilated enclosed space frequented by many people. And if you have had a large number of contact with unspecified people at enclosed confined space such as clubs or bars, you need to get tested as soon as possible by visiting a screening clinic. And today is the beginning of the last week of May. Last week, we had the resumption of offline classes for senior high school students. And starting from this week, this Wednesday, we will be resuming offline classes for high school sophomores, seniors in middle school, first and second graders of elementary school and kindergartens. And I believe that there are a lot of controversies among the public as to the offline classes, and there are great concerns among the parents. Of course, our stance is that it will be very safe if we can resume school after the termination of the outbreak. However, we believe that the COVID-19 will be a prolonged disease that will be lingering with us for a long period of time. Therefore, we believe that it is very crucial for us to strike a balance between our routine daily routines and quarantine guidelines. And above all, at schools, it is very important to keep quarantine protocols, and we need to also ask the members of the public to secure a safe and healthy environment for our students. COVID-19 is a very highly infective disease. However, it is controllable to a certain extent. If we lower the risk of local infections, we also will lower the risk of infection at schools. Therefore, we need to participate in quarantine measures, and also we need to enable students to wear face masks at schools and academies, and we need to have disinfections and natural ventilation, and we also need to screen the students' body temperature as well. So these are some of the basic quarantine protocols that need to be kept, and we also once again urge these teachers and the parents to avoid from going to nightclubs or bars, and we also ask the students to refrain from going to singing rooms, PC rooms, as well as study rooms. And the quarantine authorities will also continue to cooperate with the education authorities in securing a safe ground for our students. We believe that the core of K quarantine is the voluntary participation by the public, and in order to further curb the spread of the disease through our communities, please make it a habit to comply with the quarantine guidelines. Thank you very much.
Right, that was Chang Young, the head of KCDC, with the Monday afternoon briefing. So, what were some of the key announcements?
Well, first off, there was an update regarding the Itaewon cluster infection. We earlier had 233 cases confirmed. Now, as of this afternoon, it's 237 cases that were linked to the Itaewon case. And out of the 16 new infections that we had today, 3 were imported cases, 1 from the Americas, 1 from the United Arab Emirates, and 1 from Kuwait. And regarding the other 13 local transmissions, these sources were very diverse. For instance, one source of infection was at an arts academy school lecture, and then we had a kindergarten kid that was infected as well, and a number of transmissions at churches. So these places still remain a place with high risk of infection. And Jung Eun-kyung, the KCDC chief, also mentioned this week second graders at high schools and third graders at middle school, as well as first and second graders at elementary school and kindergarten kids will return to school. And that's why she was asking for abiding by basic hygiene measures. And there is that debate on whether actually children, these kids, should be returning to school before the virus has been actually contained across the nation. But she mentioned that this is going to be a prolonged battle, which means there needs to be a balance between daily routines and quarantine measures as well.
Right, so thank you for that. We'll see you again tomorrow.
Thank you.
Now, up next, we turn our focus to the African continent. The World Health Organization has warned that the death toll there alone could hit 190,000 amid the pandemic. For more on the situation there, I have live on the line Kim Yo-han, a Korean resident, a national that is, currently residing in Kenya. Hello, Mr. Kim.
Hello.
Some 60 Korean nationals returned home from Kenya last week, Mr. Kim. How severe is the situation in Africa amid the pandemic?
Yes, right now, as Africa continent, we have about 108,000 confirmed cases, and until now, about a little bit more than 3,000 deaths because of this coronavirus. But many people, I think, they're not really aware about this coronavirus, how dangerous it is, and people they are much more worried about the economical situations. And that's why people are not taking safe measures for this coronavirus. I think that is the one that is bringing more serious problem to Africa. And right now, in most of the countries in Africa continent, I think they don't have enough kits. And that's why, although you go to the hospital and they tell you not to come back until you cannot breathe, something like that. That's why I think those things are causing more serious problems in most of the Africa countries.
I see. Mr. Kim, what about the situation in Kenya? I understand the total number of confirmed cases there stands at over 1,000, but that the actual number of cases could be much higher than that.
Yes, that is very correct. As a foreigner living in Africa countries, and especially in Kenya, and that is the number that we are also very worried about. Especially also in Kenya, they say that it's 1,214 cases confirmed until yesterday. And actually, personally, and most of the foreigners and most of the people living in Kenya, we don't really believe in that number because we believe that this number is still low like this because they don't have enough test kit and they're not doing tests for most of the people. That's why we believe that the number is very low. But also most of these infected cases are concentrated in Nairobi and Mombasa, which is the capital city and the second largest city in Kenya. And many people, more than the coronavirus itself, and they're much more worried about the economical situations because most people, they earn daily to live their daily life. That's, I think, the biggest problem that they're thinking about.
I see. Well, aside from that, what are some other challenges faced by ordinary Kenyan citizens in light of the pandemic, Mr. Kim?
Nowadays, most of them are also wearing the mask and living the social distances because if you don't put on the mask, they now have a law saying that you have to pay about $200. And so, they're doing that, but most of the struggles that they are going through is actually economical situations. So they don't, of course, they care about COVID-19, they're worried about it, but the more concern that they have is about economical situations that they have.
Kenya has also been hard hit by natural disasters, including landslides and locust infestation. Mr. Kim, is this reality aggravating food shortages in the country?
Yes, right now, even me, when I go to the markets once in a while, I see that the prices of flour and rice has already risen a bit. And we see that they're saying that around in June, and this mass locust is also going to come again, and especially because of the rain, and there's also a lot of flood here and there, and because of COVID-19, and people are not able to take proper measures to treat these locust problem that we have here in Kenya. So we believe that this is going to come again, and also this rain problem and the flood problem is also going to continuously happen in Kenya.
That is sad to hear, though. All right, Mr. Kim, thank you very much for making the time to share your thoughts with us, and do take care.
국민 여러분과 정부가 함께 학교 방역에 최선을 다해야 합니다. 이를 통해 우리 모두가 방역이 생활화된 새로운 일상을 만들어갈 수 있을 것입니다.
In today's studio discussion, we delve into the Education Ministry's efforts to bring schools back to normal. I have Dr. Tan Hyun-kyung from Miss Medi's Women's Hospital. Hello, Dr. Tan.
Hello.
And I also have Professor An Miri from Hanyang University. Welcome to the studio, Professor An.
Good afternoon.
Professor, we'll start with you then. Why do you believe has the Education Ministry decided to reopen schools despite the ongoing concerns over the contagion?
Well, at the moment, with COVID-19, Korea is all out to protect our seniors and also prepare their ways to take the national college entrance examination. That is the most important thing for our students and also for our society. Of the many reasons, I think they have to do a lot of mock-up examination, which already started on 21st, which will give them, the students, where their national standing is, their ranking, so they can prepare the area they're missing or maybe the selection of the schools. So that is very important part of the process. And also there is a fairness problem about the students, the current seniors, and then the repeating seniors, who is about 500,000 of current seniors and 1,200,000 plus of repeating retaker of the national college examination. So they have to be somewhat in fairness in preparation for the college entrance examination. Some legal issues about the number of school days that they have to attend in order to get the graduation certificate and etc. Of all those things, the most important thing for COVID-19 that causes many school and education issues is the assessment. So many of the OECD economies also actually Italy canceled national examination. In UK and Canada and France, they will go with, no, actually Italy is only going through oral examination for national college entrance examination, and UK, Canada, France is going through the teachers' evaluation and coursework evaluation. So we are hoping to keep our schedule. That is our best solution at the moment.
And this schedule we're talking about is for the seniors who are preparing
Yes.
to enter university.
Yes.
And despite this, critics have been saying that the reopening of schools, Dr. Tan, is happening too soon. What are your thoughts on this?
Well, there are two worst-case scenarios, I think, that I'm worried about, everyone's worried about. And that's if COVID-19 gets into the school, spreads among students very silently, and one student happens to get the multi-system inflammatory syndrome, which is very severe, and happens to pass away. That would be a worst-case scenario. The second worst-case scenario is if COVID-19 enters a school, spreads, and then the children take the infection back home to their families, and then adults start getting sick. That's what happens a lot of times with influenza. In Korea, though, we're taking a very risk-adaptive approach, aggressive prevention, in addition to detection, isolation, treatment. And it's been working so far. We've had fewer than 5 deaths on a daily basis, fewer than 35 new cases on a daily basis as well. So the system that we have in place does seem to be working. So despite the recent outbreak, the number of new cases has gone down. And so I think that's why we are confident that we can open schools. We have one finger on the pulse of the situation, the other finger on the trigger, just in case we need to pull things back. And so that's the approach that we're taking.
Right. And before we delve any further into our studio discussion, I take you now over to Australia, where schools have been reopening as well. I have on the line Dr. Kirsty Short from the University of Queensland. Hello, Dr. Short.
Hi.
Doctor, health authorities in Australia have claimed that students are safer at schools, prompting the resumption of offline classes and thwarting perhaps the massive closures of schools in general. What are your thoughts on this?
Yeah, look, what we found from our research is that children they can get infected, but they're much less likely than adults to get infected. And they're also less likely to bring the virus into the home. So that scientific evidence, combined with the fact that in Australia we have a very low case rate, means that we can open schools and be somewhat confident that it's a low-risk procedure.
Dr. Short, have there been any glitches related to the resumption of offline classes in Australia so far?
So I think there's been a lot of parents who've been very concerned because obviously this is a really important issue and it's a very emotive issue. So there has been concerns raised from parents, and there's also been concerns raised from some teachers as well, because we've got to take them as well as the parents into account. So I think it's important to remember that this is a really complex problem and it's never going to be risk-free. We just need to make sure that we minimize all the risks.
There are studies, as you mentioned, Dr. Short, that show that the young are in fact less vulnerable to COVID-19 compared to their older counterparts. Could you explain that for us?
Yeah, look, we don't really understand the reasons for why this might be the case. There's a few suggestions in the scientific literature. Some people think that the common colds that kids get very regularly, especially children going to school, may offer some cross-protection against COVID-19, but we don't know that yet. What we do know is that in general, across the world, we're seeing that children are less likely to be infected than adults, and that's a great blessing.
Korea is reopening schools in phases, Dr. Short. How should quarantine efforts unfold, in your opinion, in the academic arena here?
Yeah, I think what's really key here is to be really adaptive in our approach and to monitor, constantly monitor. And so if the situation changes, we need to be prepared to change with that. And that's a big ask for teachers because we're almost asking them to prepare for face-to-face learning while simultaneously preparing for the possibility of going to online learning as well, should the need arise. So it's a big ask, but I think that's going to be key in terms of making sure that this approach is safe.
I see. All right, Dr. Short, thank you very much for joining us live at this hour.
Thank you.
Professor, and there have reportedly been no significant rise in infections after schools in 22 EU nations reopened. Now, this is according to a video conference among EU education ministers last Monday. What are your thoughts on this? I mean, this stays with the positive note that Dr. Short has been giving us.
Yes, that's very positive and optimistic note. But this pandemic also have shown us that we are so interconnected. We've been tracing each other, we've been comforting each other in global situations. So it is very comforting. However, the case in Australia may not be the same for Korea because we all have different school system and environment and the culture, especially many of the schools in Europe or even US in Australia, their students are being transported by school bus from pickup and drop off. So there is no in-between, or very little in-between places and people to meet, where we are actually exposed to many of the students on the way to school and coming to home. There are many distractions and many people they might encounter. So we cannot actually apply the same rules. However, the scientific results and the research results will be very optimistic, and the system that we actually have, with, as Dr. Dan said, is very solid, and our foundation, actually the health community, is supporting the school with that system. I think we can soon, hopefully, we can say that the school is more safer than any other place in Korea as well. I hope so.
I hope so too. Dr. Dan, there is also belief, like Dr. Short mentioned, that children have a lower chance of being infected by COVID-19. Could you explain that from a medical expert's point of view?
Well, you know, COVID-19 is a brand new disease. We've never seen anything like this before, and we're really learning on the go by observing what's happening in other countries. So, statistically, students have been relatively spared compared to adults, but they're not completely immune. And we do need to be cognizant that school-wide infections can occur. For example, in New Zealand, one of their country's biggest outbreaks happened in a school. There were 94 cases linked to one school. It was a very small school of 750 students only, but 94 cases resulted as a result of that cluster. We've also seen cases in Itaewon here, where 200 cases altogether, but more than 10% of those cases are in children less than 19 years of age. And so we know that COVID-19 can occur in children. Children can pass the infection to other children, so we need to stay careful. I think when we look at our neighbors, Taiwan and China, they've been in school for many, many weeks now. And they've been able to have school in a safe fashion that gives us some degree of reassurance, not just what's going on in Western countries, but also in East Asian countries. And their system is very similar to what's happening in our schools. And so that does give us some reassurance that we can have our kids in school safely.
Right, and along with those reassurances, we have some strict measures being implemented at schools to ensure their safety, of course. Let's take a moment now to look at some of the guidelines drawn up to ensure safety at schools amid the pandemic. The quarantine measures prior to entering the school grounds include temperature checks for all students and plans to send back home those found with temperatures exceeding 37.5 degrees Celsius. Now, meanwhile, within the school grounds, frequently used spaces are to be disinfected at least once a day. Temperature checks will also take place during classroom sessions, as well as the regular ventilation of rooms, and social distancing is also to be observed within the school grounds. Now, Professor An, what are your thoughts on these guidelines? Do you think they are enough to thwart possible infections within school grounds?
Yes, I think that is enough to welcome our students to the school ground and the classrooms. However, with the students, number of students and their hours staying on campus will be another matter. So the students and teachers and also the supporting staff will have to work with the students to prepare for something that may not be unforeseeable things that could happen with the students on the ground and in campus. So not only that, to welcome the students, but we also need the environment. The school campus needs to be more hygiene oriented, where the student can access to water, faucets to wash their hands if they need to. But we have very limited access to the water and faucets. That's something that the school, not only school, but the education ministries has to do something about that. The weather is getting hotter and warmer, so access to water would be very important, not only the sanitizer. And then also the ministry also announced yesterday that they will put 30,000 retired teachers and other staff to support school and the teachers. Definitely that will be helpful to hygiene and protect our students and help teachers. Also, the one last thing that the ministry is doing is to minimize students' presence in the school campus to be like 2/3 of the students at a time or something, so they can come to school every other day or every other week. So that's a good policy. Every other week or every other day would be very good policy to minimize the students' presence on campus. So of those things can be together worked as a something that can protect the students from our pandemic situation.
Dr. Dan, are there any other measures that you would like to recommend aside from the ones we've mentioned?
Well, the measures, they've been rigorously implemented, but they're not perfect. There is no perfect system, right? And there's some concerns about how are we going to maintain 2-meter distance between students at all times. Students, they're friends, they want to interact, they will probably want to have a conversation close to each other, not just when they're sitting at their desks, but in the playgrounds and in the cafeterias. Can we prevent that? Do we need to prevent that? That's the question. Also, ventilation is a big issue because there's not going to be summer vacation. School's going to be going on in the summer months. How are we going to have the air conditioners on with the windows open? That's something that needs to be worked out. There are a lot of chemicals that are being used right now for disinfection and sanitizing. Are these safe? What are the long-term effects? Are they safe for our lungs? That's something that needs to be answered. I think the most important part, though, is not just what are we doing with the environment, but the children, they need to have these infectious disease prevention measures become part of their habit, not just when they're in school, but also when they're at home and in other places not at school. And I think that's the biggest component that needs to be worked on right now is these personal habits that these children need to adapt and take very seriously. And just from what I've seen, I think there are a lot of children who need to work on this.
Yes, definitely. Professor An, despite these efforts, of course, on the first day of school for high school seniors last week, a number of schools in Incheon and Ansong ended up cancelling classes after reports of infections. Do you suppose this reality is inevitable?
Yes. As we were walking in today, there was a kindergarten.
A 5-year-old, yes.
5-year-old case. So it's going to be they will be more open to this and vulnerable to this confirmation. So what we need to do is have the students not only practice, but the school also have to be ready for this rolling school closures and get students ready for this time. While they are in the school, one of the first things they have to do is not to catch up with the coursework or the amount of work, but I think something that in case of such an online-offline mix, they have to practice and make sure there are enough consensus and know how to do online classes in the event of such situation arises. And also the school and the education ministry also can provide enough tools for teachers to use so that they will be without confusion, without chaotic situation, move from mixed blending situation from on and off classroom. Even if there is no pandemic or no cases of the school, they might even consider doing online and offline so that the students can practice and come back to give teacher feedback, and also teacher can give them the feedback. So once they know how to do this, I think they can minimize the students' confusion as well as the parents' concern.
Dr. Dan, aside from concerns of contagion within the classroom, there are also concerns of contagion in these areas popular among students, these PC rooms, or there was cram schools, etc. What are your thoughts on this?
I think we need to be realistic that children are going to be spending time in these kinds of facilities outside of school. The measures that we're taking so far, I think, are good in terms of preventing or not allowing children under 19 from going into some of these singing rooms. Also, the coin singing booths have been closed. I think that was a very smart move. I think, though, parents and teachers need to let children know that they have to take some personal responsibility for keeping themselves safe. And we need to educate the children in terms of what is this virus, how is it spread, and what are the measures that they can take to keep themselves safe and keep their community safe. And I think these educational steps are going to be very important going forward. It's not just a one-step process. It needs to be repeated and reinforced. And I think going forward, that will be an important measure to keeping schools open.
Right. Professor Ann, starting this Wednesday, children in nursery schools and primary schools, they're poised to head back to classrooms. Do you have any words of advice that you'd like to share with relevant authorities ahead of this endeavor?
Well, nobody had expected this situation, so I think we have to take this as a positive note and take this as an opportunity to learn and grow. So everybody is actually in it together. So teachers, it's their first time. So students, parents, and school administrators, they are the first time. So I think we need to lay back a little, and instead of being complaining and having, a difficult time, kind of try to take the wave together and make this an opportunity to grow.
I like that, making that an opportunity, and also insisting on working to raise awareness among the children for safety precautions. All right, thank you very much, Professor Ann. Thank you very much, Dr. Dan, for being here today.
Thank you for having me.
Thank you. Right, that brings us to the end of Monday's edition of COVID-19. We'll see you again tomorrow at this hour with a look at cross-border ties amid the pandemic. In the meantime, Arirang TV welcomes your inquiries and thoughts on our social media accounts or our homepage, arirang.com. Thank you for watching.